So what's up? It's about to be a very hot one today. Welcome everybody to another episode of Yarns and Trends. You know what we do here? We bring hot topics. Not just trends, but stuff that could educate you guys. And today is no exception. Today we're going to be delving into yet another very sensitive topic. Very, very sensitive. And that's why I said it's about to be hot in here. But before we start, I'd like to introduce myself. I'm your host, Prodigy. And I'd like to introduce my beautiful co-host.
Yeah.
The opinionated Miss Harry.
Hello, guys. Hi, guys. Welcome back to another episode of the Yarns and Trends. Love you.
Kenny.
And the beautiful, sexy
How are you?
Christine
Oh,
Kelani.
new level.
Hi, guys. Welcome to yet another sweet episode. We hope you enjoy.
Okay, joining us on set today, because we said today the topic is not something we can actually crack open ourselves. So we had to invite somebody very special,
Yes.
a medical student, not just a medical student, a very bright one anyway. So
Yeah.
joining us today, should I call you Chief Isaac?
I think Isaac is just fine.
Oloye.
Isaac,
Yeah,
what's up, Chief?
I'm fine. I'm good. It's
Alright.
nice to be on the show.
Oh, Stiz.
You can speak up so people can hear you.
Stiz.
You cannot be gentle on this topic. We need
It's
to.
meant-
Doctors are
Maintaining
generally not
100%
gentle. So I do
100%
not know
composure.
why. Well, Stiz though.
Steez, Abby. He's maintaining composure.
It's maintaining composure.
Okay. So we're glad to have you here.
Yeah.
And we hope you do justice to this topic for us anyways. So
Mhm.
basically, there was this trend on Twitter like last week, right?
Yes.
About some health issues with the Gen Z women, PCOS, ulcer, fibroid, which one again?
Endometriosis.
Endometriosis and all that, and why men should avoid such women.
Mhm.
So we're going to be talking about this. We're going to be picking in one after the other. This might be a very long session, and we don't even know if we'll be able to finish today or something. What is PCOS? Let's start from PCOS, because this is really ravaging a lot of women all over the world, millions of women,
Mhm.
and people hardly talk about it. I think the first time I heard PCOS myself was on a church program.
Oh.
Do you get like, oh, this person had PCOS, she just been healed of PCOS? And I was like, okay, what is, do you
What
get?
is-
No, like all these testimonies.
Yeah, I get
I was
it.
like, okay, what's
We get
PCOS? Polycystic Ovarian
Yeah.
Syndrome,
Syndrome.
Mm.
PCOS. So I'd like Isaac
Yeah.
to help us shed light into that very health issue, PCOS, in women generally.
All right. Like you already said, polycystic ovarian syndrome. It's kind of like already gives us an idea of what is wrong in these women. Just an idea of what is wrong in these women, and you can also call it Stein-Leventhal syndrome.
Sorry?
Stein-Leventhal. Just maybe
Levantine.
Leventhal syndrome.
Okay.
So just
Is that
in
a
case,
name?
yes,
Of the person who,
Stein-Leventhal syndrome. I really
discovered
don't know
it.
the origin behind
the name.
the
Oh,
other
the
name,
name.
but just in case
Okay.
you see somewhere else where it's not
Okay.
written as PCOS, but you
PCOS.
just have Stein-Leventhal syndrome.
Okay.
It's also the same thing.
Okay.
And now, the problem with polycystic ovarian syndrome, before we even get into that, we need to first know how the normal ovaries and how the normal menstrual cycle comes about, because it is a problem within or a problem along that pathway that causes the polycystic ovarian syndrome. Now, the very first thing is that we all know what the ovary is.
Yeah.
It produces the egg
Mhm.
that the sperm fertilizes that becomes a child. And if that egg is not fertilized, it washes off, and with the menstrual bleeding and everything, the whole thing comes out as a part of the menstrual cycle, as menses. And yeah, there's now that ovary itself. has things inside of it called follicles. Now, these follicles are like the functional unit of the ovary. Now, a follicle contains an oocyte. An oocyte is what matures into the egg that the sperm fertilizes. Now that follicle has various parts of it. The outer part of it is covered by the thicker cells. Then if you move further inside that follicle, you have the granulosa cells. Then inside, you then have that oocyte. Now, there's a part of our brains that regulates our hormones. A part of the brain, yeah? It's called the anterior pituitary. The anterior pituitary gland.
Yeah.
Now, it produces a lot of hormones, but particularly in this syndrome, it produces luteinizing hormone and follicle stimulating hormone. Now, those two hormones are very important, even in men, because it's what it deals with our sex organs and maturation and all that stuff. So, but in women, what the luteinizing hormone, we call it LH. What it does is that it acts on the thicker cells of that follicle. When it acts on the thicker cells, it produces what you call androgens. Androgens are what you see in men, testosterone.
Okay.
Now, testosterone is a type of androgen. So it produces androgen. Now, these androgens then go into the granulosa cell where follicle stimulating hormones act on this androgen and convert it to estrogen. Now, it's estrogen that women use. There are more estrogen in women than there are in men, and there are more testosterone in men than in women. So it's just that every sex or every gender has a little bit of both
Okay.
hormones. Now, in women, we have more estrogen. Now, it's that estrogen that causes the maturation of the uterus, is the one that proliferates the uterus. It's also the one that is responsible for how curvy a woman is and all the likes. If you look at that pathway now, where we have the estrogen being responsible for the proliferation of the uterus and the shape or curvature of a woman and all that stuff, then when we start now in polycystic ovary, that's for a normal person. Now, when a normal person produces an adequate amount of estrogen, there's something called a negative feedback pathway. That's one of the ways our body regulates things. If something is too much, the presence of something that is too much would cause the production of more of that substance. It's called a negative feedback. So if I have too much estrogen, the presence of too much estrogen will stop FSH from acting on the granulosa cells to produce more estrogen. Does that make sense?
Okay. We are following.
Okay.
We are actually learning.
Okay. Yeah. The presence of that estrogen
They
would
actually look
inhibit
lost.
the X. Okay, let me be slower with it.
Yes, please.
We have FSH acting on the granulosa cell. We get
Okay.
that part.
Yes.
That granulosa cell is where the androgens is being converted to estrogen.
Okay.
Now, when we have enough estrogen, that enough estrogen would inhibit the FSH that is converting androgens to estrogens.
Oh,
So
okay.
that pathway is for a normal person.
Okay.
Now, in PCOS, there is an overproduction of LH, the luteinizing hormone. Now, that overproduction of LH would mean an overproduction of androgens. So, a woman with PCOS is having more androgens, more testosterone than normal. Now, there are two ways the testosterone can go. It can go into the bloodstream. When it goes into the bloodstream, we have symptoms like hirsutism. Like that's male pattern of hair growth. So you see them with beards,
and stuff.
you see them with acne, you see them with you see them with male pattern baldness, alopecia. That's when the androgen has gone into the bloodstream. Now, the androgen can also go on to the granulosa cell, and FSH is acting on it to produce even more estrogen. Now, that estrogen is inhibiting the FSH that is acting on it, but there is still too much estrogen. So what would that then lead to? That estrogen will now lead to an hyperproliferation of the uterus. That's when we start having endometrial hyperplasia, because people with PCOS often come down with endometrial hyperplasia, where the wall of the uterus becomes too thick and too it grows out of proportion, because one of the ways the body controls the growth of the lining of the uterus is by menses, because during menstruation the whole thing sheds. But in PCOS, these women are not menstruating. They are not ovulating rather. And that's because they are not ovulating, they are also not menstruating. So they are not shedding that lining of the uterus. And now for those of you that want to get curvy with estrogen, now the downside is that those women end up getting obese. So the too much estrogen leads to obesity, and then the obesity then leads to hyperinsulinemia, where the body produces too much insulin, which then leads to insulin resistance. What a gram of insulin is supposed to do, 5 grams of insulin can't do it. Now they then end up with type 2 DM.
Oh.
That is the entire pathogenesis
I think you're
of
using
polycystic.
Dr. Terms. You just said DM. That's diabetes.
Yes,
Diabetes.
sorry, type 2 diabetes mellitus, and that's how the whole thing works. Now, PCOS is the commonest cause of chronic. Okay, how do I put it? Chronic amenorrhea. Amenorrhea is absence of menses. So when a woman does not menstruate for a very long time, the commonest known cause of it is PCOS. And it affects about 5 to 10% of women. So it's quite common. And some of the risk factors to it is genetics, like we talked about it.
Okay, so basically, PCOS is hereditary.
Yes. Most times, if in first degree relatives, yes, it's hereditary.
What is there a cure for PCOS?
Since the cause of PCOS is unknown. It's idiopathic, and you most likely cannot treat what you don't know, but you can manage it. You can help to alleviate the symptoms. And some people, I don't know, in some cases, if they have been able to completely restore someone that was having a polycystic ovary to someone who isn't having a polycystic ovary anymore, I really can't tell. But there are ways that those symptoms like hirsutism, acne, and infertility that some of them present with can be managed to a level where that I even saw a testimony on YouTube sometimes back where somebody was saying his wife was diagnosed with PCOS, but they just had their baby and all the likes like that. So I cannot say there is something that the divine cannot do, but medically it can be managed to a very considerable level.
That the women will still be able to conceive
to a very large extent. Yes.
Okay, so now everything you've given us now is a lecture.
But basically
a lecture for us to understand how it happens in women and all of that. But now let's go into this discussion of men saying you should avoid these women.
Why are you so angry?
I
think Miss Ire is very
She's very angry.
I think you should pick this
one
up.
So all I took from what you just said is that the cause of PCOS is unknown and hereditary, sometimes maybe from your grandparents that you don't even know.
What I said was that the cause that when we're trying to describe something, there is something called causes. We can call it etiology. What causes something? We don't know it. But are there things that we think are risk factors that can predispose someone to that kind of thing? That is where genetic falls under. It's not saying automatically that, okay, if somebody's mom or somebody's mom's sister had it, automatically you would have it. But if we see it in your family line, we'll be able to say, somebody once had it.
You are only buttressing my point.
Factor.
So whoever has it, if like a young woman has PCOS, we basically know that it's not her fault.
Yes.
Yeah. So I'm wondering why Gen Z men also think that
boys they are not men.
Why they think it's okay to just go online and say that avoid women who have this because they are going to pass it to your kids, and also it's it's hereditary, but their own mothers never had it.
Wait, before he answers that, I want to ask one very vital question.
Okay.
Does this affect only Gen Z women?
Of course not. Does it?
Does it affect only Gen Z women?
Well,
Are there health issues that we're just discovering now, or they've been there all along?
I think the reason why we are discovering many of all these things, apart from the fact that we are predisposed to things that our parents weren't predisposed to, things like diet, things like our environmental factors, we are taking more toxic stuff than they were used to.
Yeah.
Those are some of the predisposing factors, anyways. But I think now most people that have health challenges are quick to show up at the hospital. So those things are now better diagnosed or quicker diagnosed compared to like when somebody could not menstruate in the 80s or in the 90s and they're like, oh, it is witches and wizards, and they're like, now we know that it is not witches and wizards, it's something that caused something caused something.
Okay.
It's not a question. So I don't know why I am directing my anger at you, because it's not actually you. I'm just saying generally. Why do men think it's actually okay? No, for real. I just had like a second thought. Like, why do men think it's okay to, just come online and say that if you have ulcer, if you have fibroids, if you have PCOS, you should be avoided? I saw the tweet and I was so annoyed. And I just need people to be to learn about this. I'm not going to channel my anger for it. I just want them to learn.
You can channel your anger now.
No, I don't think it's going to do anything much. I just want them to learn. Just let them read a book or hear from a professional.
I think come out being enlightened before you come out to tweet. People just pick up their phones and just tweet whatever comes to their mind.
Ulcer is hereditary, and he left his girlfriend because she's always having constant headaches. And somebody also responded, oh, I'm glad you walked away from her. You just saved your kids from eternal damnation.
What the fuck?
Okay, I'm exaggerating. He did not say eternal damnation because it's not that smart.
It's not that
still.
But same meaning though.
Same meaning, basically. And I'm sure a lot of people think that, even people that don't tweet it.
Tweets.
People that don't tweet it. A lot of people like.
We're still gonna get to those tweets though.
A lot of people think that. I just feel like
we need to read their comments from there, but I feel since there's a way to manage these things and people have been managing it and they've been conceiving. I don't think if you say you love someone, you should be able to support the person, right? If the person has, but I know it is difficult. Like meeting someone now and she tells you she has PCOS. She's growing beards and have all those. The natural human will first like, no, why would I buy into this? Why do I want to go into? Do you get? So you want to, but I'm imagining a case where you're already with the woman when all these things. Does it happen overnight?
Are you talking about PCOS?
PCOS now.
Or just any other health issues
I
generally?
No, I'm talking about PCOS
just
now.
start springing out of nowhere, I guess.
Well, it's not like it happens overnight. Most women with this stuff is things that they would have been experiencing it since their teenagehood, because we define amenorrhea as the absence of menstruation for 3 months in a previously oligomenoric woman, or somebody that that is having on and off menses. Like, okay, let me break it down without using all those medical terms.
Okay.
We define like absence of menstruation. Like we define the absence of menstruation as seen in women that are having on and off menses within 3 months. Like a woman that maybe menstruates today, doesn't menstruate in next month, then that you call that kind of person oligomenoric. It's not that she's not menstruating, but she's menstruating
very regularly.
Oligomeloric. What did you call it?
Oligomenoric.
Hey,
Menoric.
And that's someone that is doing on and off. Then someone that doesn't even menstruate at all, we call the person amenorrhic.
Amenorrhic.
Now,
Okay.
you classify those kind of people. So when you have like a 15-year-old girl or a 16-year-old girl that has never menstruated, as a parent, it's kind of like a question mark. It's something to be alarmed about, because normally girls should have started their menses from the age of 13. So if you have someone that has not menstruated, a teenage girl that has not menstruated by the age of 16, whether or not she has developed secondary sexual characteristics, like maybe the development of breast and starting to get a little bit curvy and all that, you should take the person to see a gynecologist or an endocrinologist to know exactly what is wrong. Maybe it's an hormonal issue, and if it's an hormonal issue, what is wrong? Is the hormonal issue in the brain? Is it in the pathway between? Is it the ovaries? If it's the ovaries, automatically you start questioning whether it's PCOS. If it's in the brain, maybe you start questioning whether it's affecting the pituitary gland or the hypothalamus or things like that, structures within the brain that secrete all these hormones that affect the ovaries. So those are the kind of things. It's not something that a 25-year-old woman just wakes up to and she just discovers that it's coming on and off. Now, some of the things in the diagnosis of PCOS, there are certain things you need to be sure of. A woman just walked to the hospital and she's like, I have not seen my menses in like 3 months. I'm scared. And the very first thing any doctor would do is to do a pregnancy test because she could be pregnant. Once you're pregnant, you wouldn't see your menses. So it's the very first thing that any doctor should actually try to. We say something that PCOS is the diagnosis of PCOS is a diagnosis of exclusion. We settled that we finally diagnosed PCOS that, okay, I have excluded everything that can cause a woman to not be bleeding.
Okay.
It's not something that you think of as your very first diagnosis. You would have ruled out a lot of things like, okay, she's not pregnant, her prolactin is not too much, it is not hyperandrogenism. Like people that are fond of doing abortion, like dilatation.
Fond of doing
fond. You know, some people are actually perpetual abortionists. Like they are not like they are not
That's funny.
That's so funny.
As funny as it sounds, it's actually as funny as it sounds, or as should I say it because it's illegal in Nigeria, but it's actually a very common practice. Like it's a very common. Let's be honest with ourselves. It's very common. So
I honestly think it should be legal. It should be legal.
I actually think it should be legal at this point. At this point,
Really?
yes, now.
yeah, because
So
I
they will
don't
be killing
know
themselves.
actually.
No, of course not.
A lot
Like
of
there's
them
some
kill
health issues that
themselves.
would,
as a result of it.
Yeah, because
make
they
you-
kill themselves now. But if they legalize it,
Yeah,
at least you can now
true.
go
Like,
boldly to
I think a woman should
like,
be able to walk into a hospital and
have an abortion.
Now, when most of the time those people do what you call dilatation and curettage, where you use iron to go in and scrape the lining of the uterus to unimplant the baby or the implantation. Now, when you do that, if the edges of the lining of the uterus do not heal properly and they adhere together, it will prevent, even if the woman menstruates, the menstruation will not come out. So it can also be, it will present as if, okay, she has not been menstruating. And it's not because her body is not functioning properly, but the uterus has kind of like closed up at a particular point. So that's the Asherman syndrome in
Nice.
that part.
Okay, but you mentioned something the other time. Okay, now the question I asked you before you gave this response was, it doesn't happen overnight, right?
Yes.
But now you said something before that the reason why these health issues are coming up now with the Gen Z people was because they take stuff now, toxic stuff. I don't know, alcohol.
He did not mention.
He didn't mention
Yeah,
that.
I mentioned, but we
said
don't-
it
Could kind of like predispose. Like
the kind of things they take now.
I don't think
Drugs
it's actually.
and stuff.
I think pots.
I'm not
Sometimes.
sure
No
drugs.
drugs.
Well,
Okay, like
well,
what kind of stuff? then?
well, if you're talking about the risk factors, things that can predispose somebody to having PCOS, like
PCOS.
apart from the genetic part of it, like okay, first degree relative had it. If there are two girls and they are twins, and one of them has it, the likelihood of the other one having it is very high. So if that is also part of it. And then we have things like, okay, if the mother during pregnancy was exposed to like a lot of testosterone or androgen during pregnancy, it can also get into the child's body system. And also or things like valproic acid. It's an anti-seizure drug that can also cause PCOS. Those are just risk factors.
So nothing about lifestyle, I know.
Now, in the control, in the management of PCOS, lifestyle modification is one of the major controls for it. If you control what you eat and you control how you live your life, you exercise, you diet, you stay off high caloric diets and all that stuff, you can control your hyperinsulinemia, which would in turn control the obesity. Obesity itself is a risk factor to PCOS. People that like you are a 14, 15, 16-year-old girl and you are already morbidly obese, or you are too large for your age, it can also predispose. So if you for that kind of person, if that kind of person controls what the person is eating and diets and does the exercise and tries to lose weight and all that, the person would discover that his or her PCOS can be very well managed.
So you're saying that it's not basically or exactly what you consume that gives you this PCOS thing, but it's what you consume that manages.
Yes, it depends on your risk factor. Depends on
okay.
the identified risk factors. Since we don't know what causes it, but we know that there are risk factors to it. So the doctor just kind of like, based on the history that he's trying to take from you, okay, because there is a part where we have in trying to like know what's wrong with your patient, where we ask about your family and social history. Does anybody have this in your family? The reasons for that is to know exactly what your possible risk factor might be and how to address your management to suit your risk factor.
Okay. So I was going to ask, people that have intense amount of pain during their menstrual cycle. I think in the olden days, we used to think that it was normal. I used to have a friend that every month she lands in the hospital because of menstrual pain. I think all my life I've thought that it was normal, but these days I heard from somebody that has always had intense pain every month. She always has it every month. So she has conditioned herself to believe that it's a normal thing. But I think 2 months ago, it was just too much. And she has to go to the hospital. And when she got to the hospital, she found out that she had endo.
She had?
Endometriosis. And I'm just wondering, if you've had intense pain all your life, is there a possibility that you might end up having ovarian cyst or endometriosis or maybe fibroids?
Not necessarily. Although the issue of fibroids is actually a let me hold that on this hand for now, so that I don't forget it. Now, for the painful menses, that's dysmenorrhea. That's when the normally periods are painful, but then when it becomes something that becomes either life-threatening or the person ends up in the hospital as a result of period pain, that's when we diagnose things like dysmenorrhea. Because there's no how the uterus, you're shedding the lining of the uterus. There's no how. It's kind of like your body scraping off the lining of the uterus. There is no, because there are blood vessels there, there are nerve endings there. There is no how it would not be a painful experience. That one is normal. But when it becomes something that threatens one's life, or it becomes something that is associated with too much bleeding alongside, that you have to then present in the hospital because of it, that is when I think it wouldn't necessarily be a diagnosis on that at that particular point in time. It would be more like dysmenorrhea is associated with something. There is something wrong with that person that is not just painful menses, but that painful menses is what we are seeing as a symptom.
What is registering?
Like that friend of yours that you said, with the endometriosis. The endometriosis is actually the diagnosis that they arrived at, but the painful menses was just what pointed her. If she never had painful menses, there are chances that she wouldn't come to the hospital because of it. So that's just a symptom to what was going on.
Okay.
Well, what do you think men could do to support in this kind of situation?
I don't want to be supported by a man.
You just want
to
be
considerate, to be honest. I don't think there's anything you could actually do.
No, I just think you should read a book and know that.
Yeah, I don't think
like the men should read books or the women should read books.
The men.
Like, get a book.
No,
the truth is, how many people are still reading?
Yeah, true exactly. Though. Because I don't like the way that question went, like, what should men do to support
Because
It's a
there's really
secret,
nothing.
like,
It's a valid question because
I
don't
in
understand.
community medicine, I just finished community medicine posting like
I like
a month or two
community
ago.
medicine.
Now, in community medicine, there was a particular there is something called female reproductive health. And under female reproductive health, there is role of men in female reproductive health. It came out as one of my
I'm
theory
coming back to our
questions.
finish.
It
I'm
came out
coming
as
back
one
to
of
our-
my theory questions in
Actually, that's
the
what it
community
says.
medicine end of posting exams. What are the role of men in female the role of men cannot be overemphasized. A woman cannot do it all on her own.
Alone.
But
You still
actually-
need
Okay.
that.
Yeah, I know that you
input.
do, but I'm saying that instead of saying how can they support, like it's a sick person, you should
They
probably
should just
if we're
automatically
being-
know
if
how
we're
to
being-
no,
support.
how. Like that's why I said pick a book and
If we're being
like
honest-
familiarize yourself with what's happening with.
If we're
and not
being
just-
honest, yeah,
Well,
I feel
see,
like
this is
sexual
sorry,
intercourse
Sorry,
would
Kristen.
work.
Sorry, Kristen.
sexual
This
intercourse
is-
as well.
You know,
Am I wrong?
Oh,
As how will it work?
No, I don't get. I
Do
think
sexual intercourse relieves pain? Your
Oh
measure
my
cramps.
God.
your menstrual cramps. Well,
No, wait.
well, I think
that question
that one
dropped
is.
my jaws.
I think that one is like.
I read
Is
it
it me?
somewhere.
I also heard
I read it on Google.
Is
I
it?
also heard it somewhere like, but I cannot really say whether or not it does.
Because I read.
I just think
I
it's
like
the
to read.
pleasure that makes you think the pain
No,
has subsided.
I like to read, and I know I read about these things, and I've seen it like on
Maybe
different
it's orgasm that
occasions.
makes you think that the
Stop.
pain subsided. I promise
No,
you.
like they said if you that's why most times when your period is closed and you have sex, it would come, and then you don't even feel that much pain.
I don't know what
I
you're
don't
talking
know.
about.
I can't
I
relate
am-
though.
Me
I
too,
really,
I
I
can't
really can't say
because I'm
much about that.
abstinent.
How I
And
No,
I
now-
don't know, I
no. If you listen, people say it a lot. Go on
that
Google,
was
read.
yeah. I've actually
posts,
Okay,
like,
heard.
Kristen
I've
is talking
heard-
from experience.
No, I'm not talking.
Let's leave it.
I've heard like I've heard
Me
about
too,
so many things.
Yes, me too. Yeah.
I still remember when I was growing up and my dad had this book, Every Woman, where he read. I can't remember the author of the book.
Myla something,
Where he
something,
read
I guess.
it was in that book I first got to know about the menstrual cycle.
I know the
I
book
first
you're
got to
talking
know
about.
about some other things that I shouldn't know about at that time, but it was actually very expository into what a woman is and different parts of a
Different
woman's body and all that stuff. So not a lot of men, I don't even think men these days would go that much extra mile
Extra
to do
mile.
all that reading to get to understand who their woman is. Now, the little they can get is a woman comes to the hospital, to the gynae clinic, or maybe the gynae clinic, and the first question or one of the questions that she's asked is, "Where's your husband?" Reason being that whatever we are telling you, we need to also be telling
Telling
him,
your
so that
husband.
one, he can read, he would know how to better manage you. He would be your first point of contact. He knows that, okay, have you used this particular drug at this
Drugs.
particular time? Did you do this? Okay, I need somebody to help you massage this. Or you already have
That's a
somebody
lot
that
already.
you already have someone that is putting that input into your healthcare. And when there are cases like him, he would know. If he's somebody that knows that, okay, you're already in your third trimester, he would know that if it's not anything urgent, he shouldn't be traveling around that particular point in time. Or if he would be unavoidably absent, he should probably notify people around that my wife is pregnant, she will soon deliver. If she runs into any trouble, her water breaks like that, please take my wife to this, take her to this, don't take her to this particular place, ensure that she gets this particular treatment and the likes like that. So, but if these men don't know these things, many men don't even know that, okay, what is third trimester, what is second trimester,
Yeah.
all they just know is my wife is,
My wife is
pregnant, she's
pregnant.
going to give birth, and when she
Yeah.
does give birth, is it a boy or a girl? Those are the things. They don't even know many of all these things.
But that's exactly why I said men should read about this thing as well. I might have come off strong by saying get a book. I don't actually mean get a book. I just mean read about it.
Get enlightened.
Yeah.
Broaden your horizon.
That would have been better. Get enlightened.
like
and that's what we're trying to do
that's
here, right?
Gen Z lingo. Get a book.
Okay,
read
wait.
a
Let
book.
me ask you this: what are we trying to do on this
We are
podcast
enlightening
today?
them, of course.
Exactly.
But
So let's enlighten them.
But we can't.
Not-
we can only do so little. Can't
So
we?
little. Then after that, you can now tell people you can read more, you can get
you-
more education on this and stuff like
Okay,
that,
I
right?
came off strong, but the only reason why I said get a book was because there's
You
some
just
men.
don't like anything men.
No, of course not. I'm attracted to men. I love men. There's some men you tell that, okay, I have menstrual cramps, and they tell you, It's not even as painful as the kick they give me whenever I'm playing football. It's not even as this. Is not, you get like weird ass comments like that. So if a man that says that to a woman who has cramps gets in a relationship with a woman who has intense pain, is never going to understand. No matter
Actually.
how much he wants to try to be supportive, he's still going to think that, okay, she's been dramatic. She's been this. That's why I said people need to read about, not people, men and women need to read about.
No,
this
because
stuff.
men actually feel women are dramatic when they say they have menstrual cramps.
You get.
I've
that's why
heard on.
A man that
I've
doesn't
heard
know
many of them
anything
say, "Oh,
about
it's not that. It's
PCOS.
not that deep."
A man that doesn't know anything about PCOS is not going to support you in the way that you want to be supported if he doesn't know exactly what you have. So he has to also familiarize himself with that illness.
Because no
And it
matter what
takes
you
a
say
man-
to him,
It takes a man
to
who is
change.
emotionally intelligent to do all that you said. Oh, my
True.
wife is pregnant. My wife is that. No, but men do not actually
some
care.
would know the risk. Some would be
And they
enlightened,
don't
but still,
care.
they still do
And
not
there are
care.
still men that still blame their wives for the gender of the child. And these men do not even know that they contribute to the gender of the child. It's a man. It's not even the woman. The XY and the XX chromosomes come from the man, isn't it? Am I right? Am
You're
I wrong?
talking about some illiterates now, right?
Yeah.
Because
Not
at
not
this level
particularly.
of-
Not particularly illiterate.
A literate man would not even know.
Illiterate man.
A literate man
man.
would not know that is the one that it's in his hand. The gender of the child is going to give birth to is in his hand. He thinks it's the woman's fault. But these chromosomes come from the man.
That's-
Am I wrong?
Well,
No, I
it's
think
not
it's
like
a combination
it's not,
of the man
yes,
and the
exactly.
But
woman.
most of it, if you are going to have a male child,
I don't think so. Is that
No,
correct?
if you the thing is
It's-
the
it
thing
is.
is that a man is a combination of X and Y
X
chromosomes.
and Y, and the woman just
chromosomes,
has
The
yeah.
X.
woman only has X.
So
X
it's from the man.
chromosomes. So now it's kind of like 50-50 for the man. It's
Mhm.
either you are releasing X or you are
Or
releasing
Y.
Y. The woman is constantly always releasing
X.
X.
So it's the
that's,
man.
That's what makes it up. So if
And
it becomes XX, it's a
They don't
girl.
even
It's
know.
Y,
They don't
guy.
even know they are the ones contributing to this, and they blame the women. They beat them up. I've seen men
Who
walk out
beats
of their
any-
women.
Who beats
Oh, it still
anybody because
happens.
of
It still
genders?
happens.
They
You are
abandon their
generalizing
women
it,
in the
though.
hospital when they
Yeah.
find out it's a female child,
It still happens.
and it's your fault. That's what I'm saying. People should
How is it
broaden
his
their
fault?
right. It is his
How
fault.
is his fault?
You just said that. You
How
have
is
to
it
It's
his
not, it's
fault?
not like the men too can
Okay, it's
turn
not
and
his
on
fault.
and
You
off
call
Yeah.
it fault
switch.
now.
Okay, I won't call it
Because I don't.
fault. But
What you
it's-
call it fault?
it's not his fault.
It sounds like
Okay,
a female child is not a child.
I'm angry.
But that's how they make it seem.
I'm angry.
Me,
That's how
I've
they
always-
make it
I've always
seem.
said one
Relax,
thing.
Irene.
I've always. You can be angry or talk.
That's why I said
Dike,
it's his fault.
It is. It,
I like to be
Me,
more
as a person,
reasonable.
I want my first child to be a girl. I love girls. I love daughters.
Okay.
So I don't know. I don't
Okay.
know about other guys though. Like, yeah, different cultural backgrounds, different way you say things. But I believe a girl, a guy, everything are beginner. So I don't.
Everybody do not think like you do.
Exactly. There are still men that beat up their wives because they don't have
she gave birth to.
a female child.
That's crazy.
And they
man.
don't know that
That's
women do
barbaric.
not even have the Y chromosome. So it's not totally her fault. It's both of you. And there are men that have weak erectile dysfunction, low sperm count, and they blame their wives for not
Does
getting
that
pregnant.
culminate in
I'm just saying.
giving birth to female?
No, nothing. No, I'm
No,
saying
she's just
blaming
trying-
their women for not
blaming
being
women.
pregnant.
Okay, I think we are digressing though.
But it's still
Let's go
measurable.
back to
PCOS.
let's go back to our topic.
I'm
topic.
sorry.
So-
Irene is angry.
She's angry.
I'm sorry.
No, here we are free to express our anger. Shege, it will only help us get answers to some things too at
And
the end of the day.
I have this weird ass trait of smiling when I'm angry or when I'm in uncomfortable situations. Is there a name for that?
I don't think I know that one yet.
So basically, there are a whole lot of things guys can do. I mean, men can do
Mm.
to support their women in this kind of situation.
Mhm.
We might not be able to say everything here, but
Mm.
we know everybody is supposed to enlighten themselves to
Mm.
better, especially when you have somebody. It might not even be your wife now. It could be your sister. It could be a friend. It could
A
be
friend.
family. It could be a friend. So you get to better support them in this kind of situations.